Science of today is the technology of tomorrow. Good morning to one and all present here. I'm Dr. Vidushi, and I'm here to present my case, Malignant Choroidal Melanoma with seeds supported by pathology and scanning electron microscopic study. We hold no financial disclosures. Uveal melanoma, as we all know, is the most commonly occurring primary intraocular tumor in adults, and choroidal melanomas comprise about 80% of these diagnosed uveal melanoma cases. In today's case, we report a patient who was later diagnosed to have a choroidal melanoma, presented with vitreous seedings despite being a treatment-naive patient. This clinical diagnosis was supplemented by histopathology, immunohistochemistry, and field emission scanning electron study, which is the novelty of this study. This was done in conjunction with IIT Guwahati. The purpose of this study was to present an exceptionally rare case of malignant choroidal melanoma with vitreous seeding and supporting it with histopathology, immunohistochemistry, and FESEM. Coming to the case proper, we had a 58-year-old gentleman presenting to us with painless diminution of vision in his left eye for past 1 month. Patient had no known comorbidities. A comprehensive ophthalmological examination was run for this patient, wherein right eye was reported to have a normal anterior and posterior segment with a vision of 6/6 and an IOP of 10. And the left eye, however, presented with a retrolental mass, even though the AC was quiet. The vision of this eye was hand movement, recognizable only close to the face. On a meticulous indirect ophthalmoscopy, a raised melanotic mass was noted, and with subretinal fluid and exudative retinal detachment. We run a USG B scan for this patient, wherein a mass arising from the choroid from the inferior nasal aspect of the globe, extending into the vitreous cavity with haloing and posterior acoustic shadowing was noted. As a part of the metastatic workup, as well as to know the extent of this tumor, we run a T2 weighted MRI, which furthermore confirmed the diagnosis. Unfortunately, this patient had to undergo enucleation, and on enucleation, we can see that there is a mass with an exudative RD. This mass was 18.92 in basal diameter and 14.37 in its height, with histopathology suggestive of spindle A, B, and epithelioid cells, confirming the diagnosis of a choroidal melanoma. The vitreous seeds were confirmed with HMB45 positivity, and these seeds were further examined under FESEM to find out the diagnosis and differentiated from macrophages loaded with pigments or other inflammatory cells that could have been a part of this vitreous in the setting of a choroidal melanoma. In conjunction with IIT Guwahati, we tried to analyze the structure of these vitreous seeds, and after this examination, we could see that these seeds revealed having a spherical structure with smaller spherules and irregularities of pigments on its surface. The take-home message is, despite that this patient was choroidal melanoma, was treatment naive, choroidal melanoma can rarely present with vitreous seeds even in such cases. It is always wise to have a suspicion and never leave these patients just thinking that just because they have not undergone a treatment or a biopsy further in earlier days, that they can be devoid of vitreous seeds. Also, this study highlights the importance of having a creative mind open and having advancements in our imaging modalities hereafter. Thank you. I would like to acknowledge my mentor, Dr. Harsha Bhattacharjee, sir, and the Department of Ocular Pathology at SSDN. Thank you.
I would like to ask you one thing. How does the recent investigative modality that you've talked about help in further evaluation of patients or an early pickup of the disease? Would it help?
Ma'am, not in this case, because this was one of the earlier reported cases. We don't really have a lot of literature in the first place. But if at all we use these modalities, and like this patient presented much later with a mass which was really big. If we employ these modalities in a smaller masses, or sometimes these cases are really missed, if we can employ them earlier, in the stages, for sure we will know that this patient is going for malignancy, and earlier and a more tailored plan can be structured for them.